Measles can affect your immune system memory, erasing it in a way that allows other diseases to infect you more easily, even ones you were previously protected against. This happens because the measles virus attacks and wipes out immune cells that remember past infections, leaving the body vulnerable to illnesses like pneumonia, diarrhea, and other dangerous infections. This effect is called measles amnesia, and it can undo years of immune protection, which may explain why measles outbreaks are often followed by spikes in other diseases. Studies show unvaccinated children who catch measles can lose 11% to 73% of their antibodies against other illnesses, while vaccinated children are fully protected from this damage. Researchers also believe the measles vaccine has extra benefits beyond stopping measles. It may strengthen the immune system in general, helping it fight off a range of infections. Before vaccines, measles killed 2.6 million people every year and spread extremely easily, infecting 90% of unvaccinated people exposed to it. With cases rising again due to missed vaccines and misinformation, experts warn that vaccinating children protects them not only from measles, but also from losing their immunity to many other diseases. Measles is a highly contagious and dangerous disease that can cause more than just a rash and fever. It often leads to serious complications like pneumonia, severe diarrhea, and brain swelling, which can result in permanent disability or death. In young children and people with weak immune systems, measles can quickly become life-threatening.
A new treatment for aggressive breast cancer has achieved an astonishing 100% survival rate in a recent clinical trial. The study, led by Cambridge researchers, focused on women with inherited BRCA1 or BRCA2 mutations, which often cause fast-growing and hard-to-treat breast cancers. Instead of giving all the treatment after surgery, the team gave patients a mix of chemotherapy and a targeted drug called olaparib before surgery. But the key was timing. By waiting 48 hours between the two drugs, patients' bone marrow had time to recover while the cancer cells stayed vulnerable. In the trial, all 39 women who got this approach survived for at least 3 years, and only 1 had a relapse. In the group that got only chemotherapy, 9 relapsed and 6 died. The researchers think this timing trick made the treatment more effective and possibly safer. Since olaparib is already available on the NHS, the approach could also save money by reducing how long the drug is needed. The success of this trial could lead to better outcomes not just for breast cancer, but also for other BRCA-related cancers like ovarian and prostate. The next step is a larger study to confirm the results and test if the treatment is less toxic and more affordable long-term. Breast cancer can be caused by a combination of genetic, hormonal, and environmental factors. It can also be caused by inherited gene mutations like BRCA1 and BRCA2, hormone exposure, and lifestyle factors such as obesity, alcohol use, and lack of exercise. Most cases result from a mix of these risks.
A genetically engineered virus successfully shrunk deadly skin cancer in clinical trials, offering new hope for patients with advanced melanoma. Scientists modified the herpes simplex virus, or HSV1, creating a therapy called RP1, which was injected directly into tumors. In a clinical trial with 140 patients, about 1/3 responded well to the treatment, and even tumors that were not directly injected began to shrink. Patients received RP1 combined with an existing immune therapy called nivolumab for 8 days. After that, they continued with nivolumab alone for up to 2 years. Among those who responded, nearly 90% of the patients saw their tumors shrink by more than 30%. The virus is engineered to attack only cancer cells, leaving healthy cells alone, and does not cause herpes in patients. This approach, called oncolytic virus therapy, works by destroying cancer cells and activating the immune system to fight the disease throughout the body. The Food and Drug Administration is reviewing RP1 for priority approval, and a larger Phase 3 trial with over 400 participants is now underway. If successful, this could bring a much-needed treatment for melanoma cases that resist existing therapies. Using engineered viruses to fight diseases is important because it turns a natural enemy into a powerful medical tool. Viruses are designed to invade cells, and scientists can modify them to target only harmful cells like cancer, leaving healthy ones unharmed. This approach can destroy tumors directly and trigger the immune system to attack remaining cancer throughout the body.